Thank you for your interest in learning more about how to include community health workers in minority health promotion-focused, community-based participatory research. My name is Dr. Carolyn Tucker. I am the Director of the University of Florida's Health Disparities Research and Intervention Program and co-chair of the Florida Community Health Worker Coalition Research Subgroup. These groups partnered to jointly hold the People's Scientific Conference to promote minority health through community-based participatory research. Community health workers lead the way, and the 7th Annual Florida Community Health Worker Coalition Summit. Both of these events were held at the University of Florida. This two-day in-person joint conference and summit focused on the need for and how to conduct minority health promotion-focused, community-based participatory research and on the leadership roles that community health workers can and often do assume in this type of research. The conference and summit were designed for and by community health workers, community members and stakeholders, current and future health researchers, healthcare providers, and students interested in minority health promotion. The purpose of this training video is to provide you with valuable information learned from the conference and summit presenters and attendees, and to empower you to act as an advocate for the inclusion of community health workers in minority health promotion-focused, community-based participatory research. By the end of this video, I hope that you will understand the following: the definition of minority health promotion-focused, community-based participatory research, motivators for including community health workers in this research, barriers to including community health workers in this research, and strategies for overcoming these barriers. I believe that this video content will empower you with information needed to conduct and participate in minority health promotion-focused, community-based participatory research that includes community health workers. Let's get started.
The Agency for Healthcare Research and Quality defines community-based participatory research as a collaborative research approach that is designed to ensure and establish structures for participation by the communities affected by the issue being studied, representatives of organizations, and researchers in all aspects of the research process to improve health and well-being through taking action, including social change. The characteristics of community-based participatory research include the following: consideration of the community's needs and problems, but also its strengths and resources. Generally, this information is found in a community needs assessment. Emphasis on multiple determinants of health, such as the income, education, and culture of community members. Recognition by researchers and community members of each other's expertise in an ongoing, bidirectional co-learning process. Equal community member and researcher contributions and power in all aspects of the research. Trust, collaboration, shared decision-making, and shared ownership of the research. A balance of rigorous research and tangible community action. Findings and knowledge that benefit all partners. results that are shared with the community in understandable language and published with community involvement, and a commitment by researchers and community members to long-term research relationships. Minority health promotion-focused, community-based participatory research is commonly described as research to promote health and prevent disease in racial, ethnic, sexual, low-income, medically underserved, and/or rural communities. Ideally, this research should include all of the aforementioned characteristics of community-based participatory research, be empowerment-oriented, and include equal, collaborative, inclusive, and mutually respectful and sustainable partnerships.
Patria Aguila. I am a certified CHW. I've been a CHW now that I know what a CHW is, actually since the age of 16. I'm also a training director at MHP Salud, and they're a national organization that focuses on training community health workers, and we have our own community health workers, also known as promotores in Spanish, in the Texas, Michigan, and sometimes in Florida, depending on the program. So first off, as a CHW advocate, I need to make sure that you guys know what a community health worker is. Now, I did not add a slide because I like to speak from the heart. However, the CHW definition that has been adopted at the Florida Community Health Worker Coalition as well as MHP Salud and different organizations comes from APHA, the CHW section, large section. APHA has been around for a while. What is APHA? American Public Health Association. And so the community health worker definition is quite a paragraph. So what I really want you to know is that a CHW is a bridge. They are the bridge between the community at large and the medical and social services. Key word in the definition when you look it up, because I know you guys are studious, is the trusting relationship. There is a trust and a relationship with the community. Those are words that were mentioned here by Dr. Desmond and Dr. Butler. And so this relationship is very important. Because I am Dominican doesn't mean that I only speak to Dominican folks. I could be living in London, like I had a previous friend in here, and I could be part of that community, and that could be an unusually close relationship. They might be all of different places, but they see me as their community health worker, as that person that they can go to and count on.
Community health workers, or promotores de salud, as is said in Spanish, are trusted by and often members of the communities they serve, making them the true experts on health concerns and research topics of interest to their communities. Community health workers are typically trained on how to effectively communicate with healthcare providers and in implementing and explaining the treatment options and interventions. Thus, community health workers are uniquely suited to communicate regarding health promotion research to both researchers and community members. Including community health workers on minority health promotion and community-based participatory research teams, it ensures that the research methods are culturally sensitive and that the research findings are translated and disseminated to the community in meaningful ways. Finally, employment of community health workers through research projects promotes the profession and provides needed income for community health workers.
What are the barriers for CHWs to becoming partners in CBPR? Well, there's a few that I have listed, and then when we get into discussion, I definitely want to hear more, but I've listed here a few. Now, lack of knowledge, understanding of their role in evaluation and research. Sometimes, from what I've noticed in the last couple of years, our CHWs, they're on the ground but don't understand that they're so valuable in evaluation as a whole. Let's not even talk about research. I feel like evaluation is that first step. So they are collecting that data. They're bringing that information, so they have to be at the table when we're doing evaluation. But it's a barrier because they don't understand that. They don't know why would an evaluation, why are we going to sit down and do this data collection, data analysis, research, focus groups, what is that? Fear of not being able to relay the concept of CDPR to the community. So we might have a few in here that are like, okay, yep, I understand, okay, we're going to come together, we're going to work on a long-term project, but will my community want to participate? How do I translate that in Spanish, in other languages? How can I share that with them and get them involved? And maybe there's just no interest. That is something that I did want to put up. Because evaluation, it's not right now a core competency in CHW training. Though we have it in our company, but it's not a core competency. And some folks might be like, no, I like talking with people. You guys do the data stuff. I don't want to deal with that, so I don't have an interest. Lack of compensation or no compensation. Maybe that's a lot. Maybe we're working with volunteer community health workers and they're like, you want me to also what? Spend 2 hours with you in a meeting developing graphs or, trying to understand why the community at large is not attending the community health center. So things of that nature. And the last one that I added was intimidation. Some of us, and from what I've seen over the years, can be intimidated by titles. So we have doctor, we have a master's. We have someone that's been in academia for years, like, I'm a community health worker. I love my community. I'm from here. I don't know about working with them. And in reality, as you noticed, and I hope you picked up over the weekend, is that we want to work together. And academia really needs us and wants us to be a team effort. So it's definitely a mind shift from the 1960s to today.
Okay, so we're going to move on from the individual CHW level barriers. And from my experience, let me share with you some of what I have seen has been part of a system, or an institution, and the several institutions put together that are involved as stakeholders in research. So I will list several of those barriers. That lack of available training to enable them to become better research partners. Not only understanding what research is about, what evaluation is about, needs assessment, but sometimes it's not to solve the immediate issue right away, but it's for the long term. That's another kind of a delayed satisfaction that sometimes is hard for the CHW to grasp because they want to have an immediate impact. They're used to that. So that is something that we spend some time in our trainings for CHWs on research, and also for training for the research partners to understand the role of the CHWs. Another barrier, systematic barrier we have faced is dealing with the institutional review boards and the members of those committees. Many times they do have a participation, a role for a community or a community health worker in there, but if the culture of those meetings is not welcoming, they feel that they're put down, they don't receive the proper training, the other members are talking in a vocabulary and a level that is not open, then they feel that, okay, maybe next call I'm not going to show up. And that may deter their participation, their full participation in the institutional review board committees. Other systematic barrier is the limitations that sometimes the individual organization has on who can be a principal investigator. Sometimes it's mandated that is a faculty member. I'm not a faculty member at the UM. So if I have an idea, I have to bring it to my boss and it goes under his name. I could be the coordinator, I could be the manager. But the principal investigator has to be somebody with a terminal degree. So that's a serious barrier there, organizational. In terms of compensation, we already started talking about it. Sometimes I have to train the researchers saying, when they're writing the proposals, where's the line budget for compensation? Not only for the CHWs, but for a coordinator or supervisor. And it's very good, I'm happy when the investigators come to me at the research proposal level rather than at the end when they got the money and say, well, we got to do this. And I say, okay, let me see the budget. And there's no budget line for all the wonderful things that they said that they were going to do. So that is another barrier. The training of the actual researchers on how to include adequate compensation, and not only in terms of money, but also in terms of professional development as a workforce development issue for community health workers.
And I'm talking about the researcher-related barriers. I'm talking about the folks like me. Okay, so first, just lack of training on how to conduct community-based participatory research in any community. A lot of my colleagues don't know even what that is. So we talk about maybe some community health workers don't know what it is, but there are a lot of people who just do plain research, right, and leave the community out. All they want to do is do what we call helicopter research. Get their data and leave. Are you with me? Okay. Secondly, I know I'm going to get into all kind of trouble with the things I want to say. Okay, the view that only people with college-level research training can be research partners. There are a lot of my colleagues who feel that way, and researchers across the country. Third, lack of knowledge regarding what community health workers do. I was just so amazed that a lot of people that I know that I work with have no idea what you all do. It's just amazing to me. And then I thought about it. If I went back 10 years ago, I didn't know what you did. Okay? And now I realize how important community health workers are. And they don't know the important contributions that they make to CVPR to promote minority health. Fourth, lack of the cultural sensitivity that is needed to build partnerships with community health workers in minority communities. And so a lot of people have been talking about cultural competence, and all of my work is really on cultural sensitivity. So competence means having the knowledge, the experiences, and the awareness, and the skills to provide, to engage in research or to provide care to culturally different folks. But you can have all the knowledge in the world, and if you don't express or communicate that knowledge in a way that enables people to feel comfortable with you and feel like they can trust you and feel respected in the process, you can forget it. So that, are you with me? And then the other part is being aware of the biases, the racism that people bring to the table, right? And also being aware that the people have their own cultural values and beliefs that need to be respected. Everybody's with me so far? Okay, I don't know if I'm going to have a job after this, but we'll just keep on going, okay? Reluctance to share power with community health workers, because if you do true community-based participatory research, like I try to do, even the research topic, they have to help decide. Okay? So when we started our project for the PCORI project that we received the $2.1 million for, we started by having a summit in Jacksonville. That's where we're doing the research. And we asked the people, what research do you want to have done? You see, that's flipping the switch. Okay? Because who are the experts about what they want and need? Who? It's the community. You know, it's the community people. It's the people. Okay. All right. And then lastly, lack of effort to change university policies that deter community health workers from being research co-investigators and partners, as well as principal investigators. So because we want to keep the power. See, people don't want to give up power, right? And so, but if you're going to work together, you have to give up some power.
What are some strategies to overcoming these barriers? I have a couple. Yes. Participating in the People's Scientific Conference and the 7th Annual Summit. I had to just put that close. That was for fun. But really, another strategy is offering training within the organization, company, on one, program evaluation and CBPR. I mentioned this yesterday in our session, again, thinking about evaluation data programs. We have a toolkit that is free that you can train or at least go through breaking down what evaluation is and why community health workers have to be part of a team and why evaluation is a team effort. You don't just have researchers and then they develop everything. They need that data and they need your input. So offering training, and then the CBPR. As you guys may know already, Florida Community Health Worker Coalition has received funding from PCORI, Patient-Centered Outcomes Research Institute. And we are working on a training manual, train the trainer for Florida and national, so that way we have training on the community-based participatory research. And Dr. Butler mentioned there's an ongoing training with Dr. Tucker's lab as well as CBPR. So training, knowledge, and knowledge. Another strategy, providing material in the community's language, appropriate literacy level. And so once you have this information, once we are out there, again, going back to the basics when you're meeting with the community, you have to have it in their language that they understand, and always think about literacy level. I'm coming across a lot of training when it comes to literacy level and knowing that there's a difference in literacy levels and health literacy, financial literacy, so keeping that in mind. Write into proposals, incentives of funding to hire CHWs or work with the community. Excellent, I'm doing good. And last but not least, relationship building equals trust. So community and academia. Just as CHWs, the heart is to build relationships with the community they're trusted, we need to build relationships with our academia folks and our medical doctors and everyone in different levels in this team, so that there's that trust and relationship and we learn from one another.
So in terms of solution, very quickly, addressing that as a workforce development issue in terms of training, format of the training, compensation for that training. And we have been starting to do, as Patricia indicated, training for community health workers on patient-centered research. And we'll do more. Also, at the other academic institutions, when we coordinate those efforts, we have a broader reach. Many of the Health Street members of the team, they're not called community health workers, but they have a different title, but they came to my EOM research training, and we were sharing all the good and the bads, because we're all on this together. Credentialing, and that's why we will talk to you later at 2:30 about credentialing as part of workforce development. Sustainability issue with funding, and being creative about including participatory methods into the research designs from the get-go and into the budget from the beginning. Following, let's say, a rubric, a map guideline that institutions like PCORI have put together for us.
Minority community health workers can invite researchers to co-conduct community-based participatory research to promote minority health. That means that we need to have the power, and we invite the researchers, not the other way around. So we have to be confident, right, and feel that we are smart, confident, have a whole lot of important knowledge, and that you can be just as good of researchers as any researcher with a degree, right? Because you have more knowledge, actually, than they do. It's about having the confidence and knowing that you can do this. I approach everything thinking I can do it even if I can't. Okay? Really. And so in my team, right, we talk about what? What do we talk about? Self-praise, right? Now you saw I got up here and said, I got it going on, okay? Whether I do or not, okay? All right, so, but I do think so. All right, so moving right on. Researchers can take actions to become more culturally sensitive. So one is getting out of your research lab, right, and coming to the community where you want to be involved in research. You have to, you don't just wish it and you become culturally sensitive. It means you have to be a learner. You have to come to the people. Okay, community health worker coalitions can train CHWs on negotiating salaries and fees for being a CDPR partner. I feel so strongly about this. Now, all of my students know I talk to you about money, right? And for a long time, women in particular, we have a hard time talking about money, right? And so if the researcher says, we'll pay you $10, and you say, well, but I really was thinking that it would be $20. And so, then the person, and maybe you just want 15, but you got to go higher, right? And then he says, well, I don't know if I can do that. And then maybe say, well, how about 15? Well, I'm willing to compromise 16. It's called negotiation. So you've already gone from 10 to 16. Are you with me? If you want more than 15 or 16, then you got to go up to 30. Are you with me? So it's just strategies. Researchers can help change IRB, that's Institutional Research Board, Review Board, policies that keep community health workers from being equal partners, okay? And so where's Mrs. Rentz? Okay. So if you could stand, Mrs. Rentz. So we were talking about, please. I try to pay you pretty well, Mrs. Rentz, okay? So Mrs. Rentz is a retired school teacher, and I invited her to come and work in my research lab and work with me. She has her own office and everything, right? And she tells me what to do all the time. But she also is a co-investigator on our PCORI grant. Are you with me? So you can't just talk the talk. You got to do what? You got to walk the walk. Thank you, Mrs. Rentz. Okay. All right. Thank you. Thank you. And lastly, researchers can commit to and act to promote social justice and thus health justice. So I am so tired of people talking about social justice. I believe in social justice. And on all of our course outlines, we had to go back and change them and say what you were, that you're including social justice in your class. And so a lot of us just put it on the outline because that's what they said. And we get one reading on social justice, right? And I say you have to live the social justice that you talk about. You have to live the health justice that you talk about, right?
I mean, are you the type person that's going to make something happen? Or are you the type of person that's going to sit down and wait for somebody else to make something happen? So think internally about yourself. What type person are you? When you leave here today, are you planning on making something happen? Or are you just planning on thinking about, I had a great time these last couple of days? Think about what you want to do for yourself, your community, the people that you serve.
And so all I'm saying is that, we all have something we bring to the table. Be forceful in your approach. CHWs, you guys have a lot more strength than you realize. And being out in the community, you are a valuable source to those people that you help. So, thank you.
Thank you for your interest in including community health workers in community-based participatory research. For more information on how you can conduct and participate in minority health promotion-focused community-based participatory research that includes community health workers, you may visit the Coalition's website or the University of Florida's Health Disparities Research and Intervention Program webpage at ufhealthdisparities.med.ufl.edu. For additional information on the Florida Community Health Workers Coalition, please contact Cheryl Kerr at the St. Petersburg College
Gibbs Campus, Room SA 307, 6605 Fifth Avenue North, St. Petersburg, Florida 33722. You can also call 850-888-2495. Connect with us on Facebook or email us at info@floridachw.org.